Good afternoon, everybody. We are going to start, and some more people will come slowly. And I want to introduce the program, which is a patient management software, which is called AccuDent. So this patient management software is made out of 4 strong pillars. The first one is patient management software dedicated to what you do on a patient in a small or in a big dental clinic. So what you're interested in is to set up the procedures, is to set up your price list, is to set up your patient's details, is to set up the prescription, to set up the diagnosis, to make communication, which is the success of good dental clinics today, how you communicate with the patient. You are going to set up the reminders, one-time reminders, every 3-4 months reminders, whatever you want. You can set up all that. You need to be able to edit forms in French, in English and in Arabic. You need to be able to work on digital signature to avoid getting too much papers. You need to be able to read the ID cards to, in one time, set up all the information coming from a patient, a new patient. You need to be able to communicate by video in a certain way to be compliant with DHA. You need to store X-rays and you need to manipulate images. All this is including in the patient management software part, and I'm going to show you part of that. Then the second thing, which is very important, because we are all working in an environment that we need to be compliant, is DHA and NABIDH. DHA is asking for a certain number of things, including the statistics and all that. And in all dental clinics that I visited, it takes a very long time to do that because it's complicated. You will see that in few clicks, we can do it in less than 2 minutes. All the statistics can be done with AccuDent. You need to be NABIDH compliant. NABIDH compliant is very important. It's the tracking online of the history of all the patients you are going to treat or you've been treated. So this NABIDH compliancy is very complicated system. It is linked to a new language, which is called HL7. So this is a medical language, and it's new language for HP and H2 that we are using together. So now we have also the link, and this is the first pillar, to the insurances. So we implement the insurance number, the insurance brand, we implement all this, and this, if you are linked to an insurance network, or if you are not linked to an insurance network, and I'm going to show you that. Today, I'm not going to teach you how to use that. I am going to show you a few things so you understand the way it's working. And the last step, which is the 4 steps, is the link with the accountancy. This program is not an accountant program. It is a program allowing you to transfer to the accountancy a certain number of information about the VAT, about your income, about the pending payment, and about also the invoice numbers, because the invoices that you edit, you cannot delete them. It's not allowed when you are in accountancy. You can only void them. And voiding an account, and voiding a claim, I'm going to explain to you how we void a claim and why we do that. So, AccuDent is an online patient management software. This means simply that you don't need to install on any of your computer any program. You don't need to make backups. You don't need to make updates and upgrade. And you don't need to protect your data. You don't need to install software on all your different instruments, like the tablet, like the computer at the dental clinic, like on your telephone. You can even work on your telephone. And this is a big advantage, and it's allow you working in a very much more secure way than doing that on a local network. So the future is the protection on cloud instead of being installed on your clinic. So let me show you, we start with something which you need to have, and this is the basic instrument. So we are in a dental clinic. I show you on my screen here, and you have two different dentists. One is Ursula, and the other one is Arshad. Let's say we are working with Arshad. So with Arshad, we click here, and we are going to make a new appointment. And if you type a certain number of letters, like Arsh, okay, let me find one, like David, okay, you will see David, Jean-Paul, Ghislain, okay. And we have a new patient, which is here, okay? So we need another one, you select and you find another one on the list. So you have the name, the first name, the family name, the telephone number, which is coming. You click here and you make an appointment, you save. Very simple, very interactive, and you select the color of your new patients. So you can manipulate that, you can increase the length, you can, and this is going to be saved, you can modify from one day to another day, and you save. And what you can do also, you can select an appointment type, like it is a first visit for this patient, and the first visit you save, and you will see that my settings allow me to have a different color and a different time for the first time I see a patient. What you can install also is a certain number of markers. For example, a patient needs to pay. This is just a reminder. And when you will click on the patient appointment like this, you will see that there is a $sign here. And this means for the assistant that she has to take care that the patient will pay today. If you are in a big clinic where you have several dentists working together, you can add patients arrived. The secretary will do that. When the patient will come, she will click on this, and clicking on this will allow everybody who is linked to Arshad Alam Khan as a practitioner. You will get this appointment coming like this. Appointment is updated, and you hear a sign now, and you know that the patient just arrived, and you have the name of the patient. Okay, so when you read that, if you want, you can dismiss this. And then I am at the clinic, I am at the first floor, the secretary is at the ground floor, and me, what I'm going to do, I am going to tell to the secretary, install the patient, we are ready, you can send us the patient. So we click here, and she is going to hear a different sound for installing the patient. And then I can dismiss that, and I can go back to my diary, and I know that the patient can be sent upstairs. So you can change that, you can modify the sound, you can speak, you can do whatever you want. So let's go now to the patient's file. I double click, and on the patient's file, I have this. I have this, which is showing to me everything I need in a dental clinic when I have patients coming. The first thing, I'm going to start from the top, is the patient's name. I have the patient's name, and I can open another patient. When I want to search for a patient, I can search on some letters of the first name, or on the family name, or on the telephone number. So whatever you do, you will be able to find the patient in a very easy way. After the patient, you have the age, which is calculated automatically, and it gives you the age of the patient. And then you have something which is interesting for dental clinics. When you do prosthesis, you have cast. So what do you do with this cast? You keep them in the clinic, you put them on a shelf, and 3 years after, you don't know that you have that, and you throw away everything with the dust which is on it. So now you can select where is the cast, in the clinic, or it's been given to the patient, or it has been scanned and you keep the scanner of your cast, or it has been deleted. So doing that, you know what has been done with the last cast of the patient. Next to this, you have the insurance. So at a glance, on one line, you know a lot of things about what you need to know when you treat a patient. This is the insurance company linked to this patient. So if you're working in a network, when a patient is linked to Aetna, it will be granted with the price list of Aetna, and you will implement the price list of your clinic with Aetna. If you are not working with an insurance, but is reimbursed by Aetna, you will have your price list given to him. But in this case, Aetna will be the claim form, which will be edited for what you do when you do an invoice. And there is a file number. You cannot change the number here. It is this display. It is the paper file of the patient. We need to have a paper file. We try to work paperless more and more, but paperless doesn't mean that at the end we will have no paper. Maybe one day, but I'm not sure of that for a long time. So we need to have a link to a paper file where you have the signature of the patient, the agreement, and things like that. So let's go now to the second line. On this second line, you have a series of information which are very important to understand. The first thing is the patient's card. So the patient's card, in the patient's card, you have on top the picture of the patient. If in images, I have been storing the picture of the patient, I can click here, link the profile of the patient, and I have the picture of the patient. I select this picture, and then I can put the picture of the patient. So, of course, this is not a female, but it's a male. Okay, so I put Mr., male, René, Nahum, it's a male. You have the mobile number. You need to edit always following the same format. And you have the email, and the email must be tested and must be validated, because today more and more emails go to the bin, go to spam directly. So if you want to be sure that when you send an SMS and when you send an email, you are doing that securely, you need to work with SMS and SMTP. So for that, you need to buy some SMS and SMTP. It's very cheap. It's around 7 fields for one SMS, and you will get that in a good way and working in a good way. All your patients, you are sure, will receive your emails. The advantage to work inside AccuDent with this is that you have a tracking. So when you go to history, you will find all the tracking of what has been sent to your patients or what has been edited. So if you don't want to use the internal system of emails in AccuDent, you can always click on this link here, and doing that, you can send email from your own email system, and you can link things outside of AccuDent. So it's a fully open system on both sides. The date of birth is mandatory. It's not mandatory by us, but it's mandatory for NABIDH. So when you are in touch with a new patient on the phone, you will now ask this person to give you his or her date of birth, because we need that for DHA and for NABIDH. And you will enter following this format of date, month, and year all the time. So this is the part which is important. Now we go to the rest. We need more information than before. I could stop with that. I have the name of the patient, the age. It's enough. No, it's not enough, because we are linked to DHA and NABIDH. So we need to send them a certain number of information, like the state of residence. They need that. It's not me, it's not you, it's the state of resident. And next to Dubai, for example, you have a number, and this number is mandatory to use when you work on the statistics. Okay, so instead of finding this number, instead of writing this number, instead of making mistake, you select from the list and it's done. Okay, so this is the state. We are going to say that it's Dubai. Then you have the nationality. So this René Naoud is from Algeria. We have the region. What is Algeria? It's an Arabic country. Other, we click here. And all this is not needed for you. You don't care about that as a dentist. You care about that because you need and you must be compliant with NABIDH. What it means to be compliant with NABIDH, the history will be online of your patients, but DHA will come to your clinic, and even if your clinic is NABIDH compliant, they are going to check that you are using it in a good way. And if it's not the case, they will give some fine. So be careful. This time is coming now. We have to be not only compliant, but we have to work in this way. This is the file number. I explained to you what was the file number. Document type. The document type is coming from the ID or the passport, driving license, or GCC ID. Okay. In this case, we are going to work with an ID card. And instead of writing things like this, we have a way to scan ID. You see scan ID here? Okay. Alors, let me save and I show you the scan ID. Okay. I show you what it is. I go to scan ID, and on scan ID, I can scan Emirates ID, front side and back side. So I'm going to take a selfie. I don't want that. I am going to switch the camera, and switching the camera, I can put the ID, and I can save the ID, and like this, all the information coming from the ID on front side and back side will be implemented automatically. So this means that there will be no mistakes in editing the first name, the family name, the date of birth, the nationality, the ID document, and which ID it is. All this will be implemented automatically with two pictures that you're going to take of the ID. So you link this new patient to a practitioner, the assistant will do that, and you can link it to a family. So if you want, you can add someone who will be in the family of this patient, okay? So when you will see people of the same family, you will have in the payment all what is due, but all these people from the same family, and maybe the father will take care of paying for all the family. We have stat search. Why do we have that? This is to edit the statistics. So you have Emirati, non-Emirati, and international. Most of the non-Emirati are international, but international means visitors. So based on what you will write here, you will get, let's say, non-Emirati, and a non-Emirati will be linked automatically when you are going to edit statistics on non-Emirati. Appointment type, okay, so this is appointment type, and now we go down to insurance. Okay, there is the address, which is okay, and now we go to the insurance. So your patients are not insured. You put not insured, nothing is coming here. In some cases, the patient is insured. When the patient is insured, you need to select which kind of insurance, okay? So let's select AdNIC. So you have the expiry date, you can put that. You have the insurance number, you can edit an insurance number on that. You have the insured name, insured date of birth, and insured nationality. If the same patient is at the same time the insured and the patient, you click here, and this will be filled automatically, as you can see here. Okay. In some cases, and this is not us, but this is required by NABIDH, the person we are treating is a VIP person. And all what is about the VIP will not be sent to NABIDH. There will be a strict closure of what is sent. If your patient is VIP, only you will get the information. The bottom part of that is about the appointments. So you can click on before the appointment, 1 day or 2 days before the appointment. We are going to send one SMS to the patient and one email. When you do that, no need to call the patient, no need to send, all that will be done automatically. So you have also a one-time reminder. What is this? You need to remind your patient to come one time. For example, I have a one-time reminder that I'm going to send by email for patient, and I have a layout for after healing reminder. I give you an example. Today, and I put the date of the day today, I have been, so let me do, so 02, always the same thing, 02/06/2022. Okay, so the same format. You need to be very strict. You use absolutely the same format, date format, and telephone format all the time. So this is the reminder date. So in 3 months, let's say 09, okay, at these days, in September 2nd, I will send an email. I have been placing an implant today, and I need to activate the implant at that time. So I can send an email, and by chance, I can also send an SMS. This is a treatment follow-up, okay? And doing that automatically, in 3 months, your patient will know that he needs to take an appointment. The last system is the periodic reminder. Periodic reminder can be used when today, I have been making a cleaning. So I want the patient to come back to see me in 6 months. I click on 6 months, I send an email, and this email will be next cleaning reminder. So in this way, I don't need to do anything. He knows that in 6 months, he will have to come back to make a second cleaning. In some cases, we use this in orthodontic treatment. In orthodontic treatment, we need to find the patient once a month, okay? But once a month, some people, they will not need to get an appointment for next month. They don't know when they will be free or out of the country or in the country. So it's not next cleaning. It will be appointment, not appointment reminder. It will be another after healing, okay, or follow-up, and you can change all that and edit as you want, okay? And every month you will receive that by the next implant activation or after healing, so you can do an SMS also. Voila, this is the way to put periodic reminders, one-time reminders, and automatic reminders before you get an appointment. And this will free the secretary to do a lot of things, and she has no time to do that. She has more things to communicate to the patient, and what we give you here is just a tool of communication. So now you can send SMS, you can send email. I am going to talk to you about images. So more and more today, in medicine and in dentistry, we work on images. So these are the 2 documents I have been working on like this. So and I have a tool to modify the document. So I do this and I reshape this and I do it. As long as you take pictures, clinical pictures in a mirror, I can delete this one. As soon as you work on a mirror, so the images will be different images. Let me give you an example. This has been taken in a mirror. You have one side, so you make a flip horizontal, and you have the other side. This is implemented in AccuDent. You don't have to use another program. It's always inside the program that you will be able to find everything. Why do you need that? You need that to show to the patient. You need that to communicate. And now you have the OPG. The OPG, the last OPG will come here. Of course, you can open the OPG and you can check what it is. What you can do also, you can go back and you can, let me go back to the images. Let me go back to OPGs. You can click and drag and you put that on your computer. What you can do also, you can put a picture which you have on your computer and you can put it back on AccuDent. This is very easy. This is very simple. Our objective is to make things easy, simple for you to work. You need to work with that. So if you want to delete several at the same time, you click and then you delete. And then you can work in a simple way. So if you have X-rays, in many cases, the X-rays, they are in the wrong position. Maybe these teeth are not from the upper right, they are from the upper left. Okay. So to know that, you have to go back. You have to go back to X-rays, and I am going to save this, and I'm going to make an horizontal flip, and it will show me the teeth on the upper left side instead of the upper right side. And this happens when you are storing the X-rays. In some cases, we don't know exactly how to do. So you can load the documents, you can load the images, you can load the OPGs, and the OPGs, the last OPG will be displayed on the patient's file. So I go to the patient chart, and the last OPG is displayed here. So at a glance, you have all the patient information. You have all the details where you can work on that. You have your chart. You have your procedures, your selected procedures for you, not for anyone else, with your price list, with the price list of the network, if you work with a network, and this. So when you have that, when you click, you can show that in full screen. I show you that again. I close this, I click, and I have that in full screen. I want to make it in zoom in, it's in zoom in. Doing that, what you can start doing, you go to initial. Initial, you are going to set up the chart based on the initial state of the patient. When the patient is coming to you, you take an X-ray, you look at the patient, and you are going to do something. So what to do? If by chance you have an impacted molar on one side, you click here, and you will have an impacted molar on the chart. If you have an extraction, so let me do it with you. I have here only one molar, so I can extract the second molar, the impacted molar, and all is same as here. And now, instead of making a root canal, making a post, making a crown, and doing all that on that tooth, I click on this, and I have everything in one shot. I have the root, the post, and the crown. I have this same on the lower. I have the same on the second one. I have the same on the upper molar. I have the same on the lateral, on the canine. So I click here, and step by step, I am making the chart of the patient. And then what I have here, I have missing teeth because I have a bridge. So I have this, and I make the crown of the bridge from this tooth to this tooth. And doing that, I am matching all this from the chart to what I have on this side. Me, I don't do that. It's Tuba, my assistant, who is doing that, and she's doing that very well. And allowing that, I am able to see what is the state of the patient at the initial step. So let's go now to what we can do. You have tabs here, and based on my tabs, I am going to send information. So I am in initial. So you see this, I am going to current. Current is the same because we have the same as the initial. I can do a treatment plan. And when you do a treatment plan, you need to explain what is the initial state. So you go in semiology, and you see in semiology, for example, that I have a tooth which is broken. So I click on this, and you see cracked tooth, one tooth. I see this tooth is broken. And this tooth is broken, and as long as it is broken, I am going to make what? A root canal. I go to endo. I make a root canal. I select a root canal on this tooth. I am going to make a post. I make a post. I am going to go to fixed dentistry. I make a temp. I put the temp, and I'm going to make a zircon crown, and I put a crown. And that's it. And my treatment plan is done. Not only on the treatment plan, you have the procedure, but you also have the diagnosis. And we are going to see all this all together. So I select what I want to do as a treatment plan, and I go to a signed document, which will be called quotation, sign. Doing that, you have the quotation with the logo of your clinic, the clinic, and you will have that. If you want to display here, if you want to display the diagnosis can be displayed. It's up to you to do what you want. I have just to display the price of that, and you have the price in letters, you have the VAT, and you have the total price. And now the patient, and you can work on a tablet for that, will make a digital signature. So you scroll down on your tablet, and you can make a digital signature. We save the signature, we say, okay, and instead of printing that, you can just save that, and it will be saved in the history of the patient. So the patient will know what he has, and this will be done automatically in a very fast way from your file. So I am going to update, and I'm going to show you that we have in history the quotation signed by the patient. You want to see what it is? I click on that, and I have the quotation which is there. So you don't need to print. You have everything digital today. But if you want to print, of course, even this one, you can take it and you can print it. So you go to printer and you can print this document. And you can make a signature for print. Arshad, wait a minute. I need the... And now I am going to show you something else. So we are working in the history. We have form, quotations, emails, all these emails, all what you have is in the history. You make a prescription, it's in the history. So you have the tracking of that. This is exactly what we need in the dentistry today. We need the tracking. So let's go back to the chart and let's see how we can work. So I go to images, and you are working in an old system, and this old system is you have X-rays, you have OPGs, you have pictures, and you are like this one. I put a patient with documents, with OPGs, with X-rays. So what I do, I just zip this, okay? And all the documents you have, you need to edit the same name of the folder: document, image, insurance, movie, OPG, others, other, scanner, X-ray. You need the same name. When you have the same name, all this is zip, you put it in upload zip. This means that you can transfer all the information to the new software you was using in a very simple way. No need to make complicated things. This will be very, very simple. 90%, 100%, the documents are uploaded. And when you go here, you go to image, and you have the image which have been loaded. You have the OPG, you have one more OPG which has been loaded, and you have the X-rays which have been loaded also. So all this is loaded in a very simple way. You have more X-rays there. So now you have the upload image. You can select on your computer where are the pictures. For example, let me give you an example. I have that. Okay, I'm going to go slowly. I go to image. I choose from my computer. I select some images. I have some image, this one. Alors, let me find a clinical image like this one. I open, and this image is coming in my AccuDent file. So you see how easy it is to go in and out AccuDent and how to exchange files. For example, when you are making one OPG or one scanner, You can upload that directly because it's on your computer. You click and drag and you put it on your file, or you browse and you find where it is. So this is the management of the X-rays, of the OPGs, of all that. What are you going to do with that? So let me go back to the patient chart. I clean up. I go to the patient chart. Here it is. So I had the treatment plan. The treatment plan is in the history. I can send it by email. I'm going to show you how I can send it by email. So I click on email. I am going to send a document. So the document is sent to the patient, and I can put someone in CC. Who can be in CC? All the people who are in my contacts list. So all the people who are in my contact list. So whoever it is, I have this patient, this dentist, reception, okay, and I can select a document. The document will be this form, and in this form, I can send a document. So I'm not going to send to this, I'm going to send a document. Or what I can do also, I can go here and I can send an X-ray. I click and I have an X-ray. The X-ray is too big. I make a right click and I change the X-ray size and I go to 100 instead of 300. And it's very easy. I keep that. I keep the proportions. We say that. And it's easy. You have all, and you can send that by email. So you can manipulate images. You can send images. You can modify images. You can go in all directions based on the image you have, which are stored and can be used in every way. Let's go to prescription. Prescription due to NABIDH must be done in a different way to do today. So you cannot do this. I give this example, but this is the example of what you can do. Most of the time, you are making the same kind of prescription with antibiotics, with anti-inflammatory or mouthwash or whatever you want, okay? But this is not accepted by NABIDH. You need to add the prescription one by one, medicine after medicine. So this, we cannot do that. As long as we cannot do that, I'm going to show you how we can do. We open a blank page. On the page, you will have the patient age based on the date of birth. And I say, for example, I'm going to give you antibiotics. I click and I have the antibiotics. And now I click and I'm going to give antalgic paracetamol, Panadol 1000. Okay, I am doing that. And this is accepted by NABIDH. So when this is done, very easy. And it's provided with everything. So if you want to add more, you can do it. You save in this tree, and saving that, you have your prescription, which is coming here. Okay. So with the digital signature from you, and you can print it, or you can save it and send it by email. So once again, in the history, you will find, so it takes a little time to go to the history. So, but you will get it soon. Go to history, prescription. I have the prescription, and this is my prescription. You have the tracking of everything to do. So now we go back to the chart. This is the chart, and we are going to do something. We are going to go to current. I remove that. I delete that. And I am going to show you how we are going to place things. So I cannot delete it. Why? Because it has been posted. So forget about that. Let's go forward. So I go to a surgery, and I am going to extract this tooth and this tooth. I remove 2 teeth. You see here, I have been removing 2 teeth. So extraction. So let me do it again because I went too fast. I remove that tooth. Okay. Okay, it's a demo. So I want to change the price. I change the price. Instead of 0, I am going to put 500 on that. and I say yes, and okay. And I put the other one, also 500, and I can change the price if I have a price. If I have a price, this is the patient's fees. You have the copay, which is the insurance, and the sum of both is the total. So in some cases, you will add something to the price of the insurance. In some other cases, you will not do it. So now we are going to make a denture, okay, removable denture. So I go to removable denture on the lower. So I click on this, and I'm going to do a denture with 2 teeth, okay? And here you see that the denture is coming, and you should have the price of the denture, and you have the price. So doing that, now I can make an invoice. I select what I have been doing. I go to insurance, which is the invoice. And by default, it's coming to AdNIC because the patient is an AdNIC patient. Okay. So on this, you have the diagnosis, broken tooth, if you've been editing broken tooth. And at the bottom, you have what has been done to the patient with the price and the full price. And after that, we have been editing also a free invoice, okay, separate from this one. If you don't want to print that, you just remove it, that's it. So you download the PDF and you post. This means that it has been done, given to the patient for payment. So it's posted, you can print it, or you can just save it. Nothing to do for save, it's saved automatically. You go on that, and you have that will come in the history. After a while, it will come in the history. At the bottom, you see that when it's posted, the background is changing here. So if I want to go for payment, I click here, and I have this invoice for 1,000 wants to be paid. So we have 2 invoices, none of them have been paid. So you can pay both of them. I click here, and the amount will be updated automatically here. I click here, I have the payment here, it's paid by credit card, I save, and it's done. So not only you can do that for one patient, the payment for one patient, the payment will come here, down here, you see, and each line is separate for each different invoice. Because now, in some cases where you are in a network, the invoice number will be linked to the payment, not the name of the patient, the invoice number. So now we work with invoice number also for the accountancy. And for the accountancy, so we can make a VAT list. You click here, and you have all the list of what was edited. This is the invoice number. Once again, I come to the invoice, number 1, number 2, number 3, number 4, number 3. There is no missing invoice. And this is what the accountant is looking for, okay? But some invoices have been posted, and some invoices have been void. You cannot delete an invoice, but you can void it. Let's go to Fadila El Arab. We go to this patient's file, and on this patient's file, we have what? We have a series of information in the history. We are going to go in the history, and we are going to check what is happening. I click on history, and on history, I have the claim form edited AdNIC number 212, and this is void. And you have the amount which is coming here. This is void, and some others will not be void. And in some cases, you can also reimburse the patient. So this amount will be deducted from the income that you have been doing on this patient. So you see, everything is possible, but possible in a simple way. And the tracking is a full tracking. This is what we need today in dentistry. So talking about the tracking, I am going to explain to you what we need to do. When we do anything, when you do, let's say, a root canal treatment, we make a local anesthesia. So we make a local anesthesia, double click, local anesthesia. Local anesthesia is coming here. And you see here, you have a number. This number is a number coming from the box of anesthesia that you've been opening. So to show you where to do that, I go to settings, I go to procedures, and I am going to go to anesthesia. Anesthesia, I click on local, and I have this traceability number. I remove it. You don't see me, but I explain to you what I'm doing. I remove that. I have a box of anesthesia in my left hand. I have a scanner, and I am scanning the traceability. All these compounds of anesthesia will be used not for one patient, but for all the patient until the box is finished. Okay, so you don't need to scan the box every time you use it, but when the box is finished, you replace with another box. You will just fill the traceability in the procedure. So I save this. It is saved. I go to my patient's file. Let me finish that. Finish this. And here I have the patient's file. It's coming here. Voila. I close this and this. And this, I don't need that. So in the patient's file now, I have been doing, okay, let me do it again. Local anesthesia. I have been doing a local anesthesia, and you see the traceability number is coming from this. You have also a comment. You can fill a comment, let's say, difficult to do the anesthesia or whatever, you can do it. You double click on this line and you go to comments and you write whatever you want for this procedure on this patient. You close. So now I am going to make in endo, I am going to make a root canal, for example. I make a root canal, okay? Or I am going to make an implant. Allez, let's go and make an implant. You will understand better. I take an implant, I put an implant here. I have an implant. And what I need to do here is to place the traceability of the implant. So we are talking about the same kind of traceability, and you have to put the traceability. It's mandatory to have the tracking of what you put in the body of the patient. So the traceability will not come from the anesthesia, but we will come from the implant box. So I have an implant box in my hand. I will go to the QR code. I scan the QR code, and the QR code will come, and I have all the details of my implant, which is coming here. It's an easy implant with this size and this tracking number, and everything is there. And this is what we need to give to DHA. We need to give the traceability of that. But we've been doing, this is not enough. We've been doing to the full traceability of what we are doing. We are working on this procedure, which is called ancillary. Ancillary is all the pouches you are opening. So I make a double click. I put the ancillary. The ancillary is all the pouches we are working on when we made a surgery. So the cursor is at traceability. And what I'm going to do, I take the pouch, which is empty now. We've been using it for the surgery, and I scan it. And you have all the details of the pouches we've been using. Here, all the details of the kit, the explicate, and everything is there. So I say, okay, I can use 1 and 2 and 3 and 4, and all will come there. So now we have traceability of the sterilization. So we have traceability of the product used for several patients, the same kind of product, traceability used from one patient, like an implant, and traceability of all what has been used until the final patient. So this means that, and this is the three kind of traceability that you have, and this will be implemented inside your patient list. If you want also to have the history of all what you've been doing, you select all, and you go to a form, and this form will be a different form that we call history. And doing that, you can communicate all what has been done to your patients in a very easy way. So all this is implemented in the same program, which is called AccuDent. The prescriptions, the forms, and also in the forms, you need to have an informed consent for anesthesia, for cosmetic dentistry, for extraction, for everything, you need that. Not only you need it like this, but you need it in Arabic also. This is mandatory by DHA. And you need not only that to be signed, but to be signed by the witness. So doing that, we go to digital signature. And if you don't work with a tablet, you don't go to digital signature, you can print it and make it sign manually. So print and sign manually or digital. We are working on digital. So in digital. So this one, the patient signature is already in the memory. So no need to do it, but we need this one, save signature. When the signature is saved, then the document can be saved or printed, and it's in the patient's file automatically. So this is the signed document. The scan ID, you know, and I'm going to finish with one more document that you need to know. It's about the video. So we've been implemented a link to an external video system, which is called Zoom. So this is, let's say, emergency. The patient needs to talk to someone because the patient is anxious, he has a broken tooth or big swelling. So we create a link, we click on the link, and based on the link, we start the meeting. They don't need to install anything. They don't need to do anything. So me, I need to cancel because I'm working already on Zoom. So, and in this way, you will be able to talk to your patient face-to-face, and this is very interesting to do. It is not allowed by DHA to have an internal system. So what we've been doing, we've been making with an API, a system independent to AccuDent. So now we are fully compatible with what is needed. So now we go on the top. Now you have seen the payment, you have seen the history. We go to the medical. Medical is a questionnaire where you have a certain number of things to answer. So you can do that with a tablet next to the patient. The assistant is going to ask a certain number of questions. Okay. So let's say bleeding. Yes. Okay. And bleeding, why? We're going to put aspirin for example. Okay. So when you do that, you save it. And of course, you can make a digital signature for the announcement, but we are not in that. We are going to go directly to, okay, let me close this. And we are going to go directly to the patient's file. In the patient's file, we've been going to medical. And you see that at the bottom, you have a banner which is coming now, bleeding aspirin. This is exactly what I want to see. At the time I have access to my patient's file, I need to know if there is any issue with a medicine or anything, allergy or whatever. So this is coming like this for the questions we have on medical. I am going to take another one. I am going to go to another questionnaire, and this questionnaire will be the dental questionnaire. The dental questionnaire is a certain number of problems which are expressed by the patient. It's not a diagnosis. It is something like, I don't feel good when I chew on my teeth. Oh yes, I have an issue. When I chew, I have some pain. Yes. At what date? Today. Is it active? Yes, pain. And here in comments, you see that it is on the lower right side. This is what the patient says. Okay, this is not you. And you should listen to the patient, because when the patient is saying something, we need to listen to them. Because the key of what we're going to do is to answer to the problem of the patient. So when I go here again, I am going to update that. And I'm going to see at the bottom that not only we have bleeding aspirin, but now we have, I don't feel good when I chew on my teeth. Okay, on the lower right side. And this is important to know what's going on with that. So let me go to a different place. I am going to go to vitals. Vitals, most of the time we don't take the oxygen saturation and all that in a dental clinic for sure, but we have no choice. This is mandatory to be filled for NABIDH. So if you want to fill it, you fill it, but most of the time we will not fill it for sure. And then allergies, you have allergies to a certain number of things like feather, walnut, seafood, peanuts, but I am not holding a restaurant. I don't care about that, but I have no choice. This is the list which is mandatory to be filled for NABIDH. What I'm interested is not eggs and fruits and nuts. I'm not interested in that. I'm interested in allergy. Yes, I have allergy to penicillin. Voila. This is very important for me to know what kind of allergy I have. And I put save. And when I open my patient's file, I am going to update this patient file. And then the allergy is coming. And this is important for me to see that. So I know the patient is bleeding because he's taking aspirin. He has allergy to penicillin, and he does not chew well on the lower right side. We know the patient. It's written there, and we have all the information. We have the X-ray. We want to see the X-ray in big screen. We click, and we have big screen. We want to see all the initial. We want to see what we've been doing. Everything is just for us. Okay? So based on this, you have the traceability, you have the price, you have the invoice, you have all in one end. And this is exactly what we wanted to do with this program. So I finished my presentation on that. I hope that you've been able to discover the field we are working on. And if you want to connect in one way or another, if you want to connect to us, we are the manufacturer. This means that we are not reselling anything. If there is anything wrong, we can correct it immediately. We are working all time, full time on that. We are the manufacturer of the program, and this program is particularly dedicated to Dubai. We are making extension with Malafi to Abu Dhabi, and we will extend in more countries after. But we start with you with full compliance with NABIDH, full compliance with DHA, and also all the details of what you have and what you need when you treat a patient. I thank you for your attention. Feel free to contact Arshad Alam. It's very easy to have contact with us to go forward and to install that in your dental clinic. Thank you for your attention.